Hey guys, it's Dr. Dan coming at you from Town Health. I wanted to do a short video on some of the ways to make your mask more comfortable during the COVID-19 pandemic. It doesn't appear that we'll be going without masks anytime soon. So there's a couple of tips and tricks that I've kind of picked up or have known about for a while that make this a little more tolerable. We can essentially all agree on the fact that wearing a mask, either one of these specialty masks that are for kind of medical providers, or one of the cloth masks that a lot of people are wearing, is that eventually you get to a point where you feel as though you can't breathe very well. And that is based on a physiological mechanism called your carbon dioxide tolerance, or your CO2 tolerance. The number one way, we'll skip ahead in the video a little bit, the number one way to not feel like you're running out of breath as you wear a mask is actually not to talk that much. So we're going to see how much of a challenge this is for me. But getting back to your CO2 tolerance, your CO2 tolerance is essentially how much CO2 you can have in your blood without feeling the need to gasp for air. All right. So athletes have a very high CO2 tolerance. It's why they can work through a lot of energy output and still just breathe at a pace that a human can breathe at. Most of your average people do not have a high CO2 tolerance. Because we don't have high CO2 tolerances, there's a couple of approaches that I've been taking, and they've been working out because I'm still able to talk a lot, and I talk a lot all day, as you can ask all of my patients know. So there's a couple of techniques in here. The first technique is one, like I said, try to talk less. If you talk less, you can breathe better, and you're not putting as much CO2 into your mask, so you're not rebreathing as much CO2. So that's probably the number one intervention, is try to be quiet. Try to use your listening ears a little more. The second really, really powerful intervention for not feeling like you want to rip your mask off to breathe some air is to breathe only through, I'm going to try not to touch my mask, breathe only through your nose. If you nasal breathe, one, it stops you from blowing out extra CO2 for you to breathe back in. So it decreases your respiratory rate in general. Two, it causes your body to release something called nitric oxide, which acts as a vasodilator. So your nasal tissues release this, and it makes it easier for more oxygen to get to your tissues so that you don't feel like you are lacking oxygen. The third thing that you can do to make this a little more comfortable is to actually train to increase your CO2 tolerance. And there's a lot of different ways to do that. And you can scour the internet for countless different interventions to try to increase your CO2 tolerance. But essentially, it's like anything else in the world. It is almost like a muscle in that you train it. So if you want to get better at handling higher levels of CO2, you need to just subject your body to higher levels of CO2. But if you do it in a controlled fashion, when you don't have to wear a mask, such as in your living room, it'll make wearing a mask when you have to go to the grocery store a lot more friendly for you. So there's a couple of different ways of training your CO2 tolerance. One is just breathing less. So you can use something called box breathing. Box breathing has been shown to decrease cortisol levels, and essentially you breathe in a square. All right, so you would inhale for 5 seconds, hold for 5 seconds, exhale for 5 seconds, hold for 5 seconds, inhale for 5 seconds. And that's one cycle. As you get good with that, you'll realize that you can start to breathe in for longer, hold for longer, exhale for longer, hold for longer. Most people breathe somewhere between 12 and 20 times a minute. And if you're doing a 5-second box breathing protocol, you've got your breathing rate down to 3 times per minute. So it's a very big reduction in breathing level. If you up that to 10 seconds, which is what I can comfortably do most of the time because I've been doing this for a while leading up to the idea that I'm going to have to come back to practice full time and wear a mask all the time, is you're now breathing 1.5 times a second, or 1.5 times a minute, excuse me. But don't start there. Start with like 4 seconds. Start with 4 seconds to get comfortable. But what you'll see is that the less oxygen you breathe in, the more time you spend increasing the level of CO2 in your blood because your body's still living. So start slow and just get into it very gently. Start with maybe a 3 second or a 4 second, like I said, work to a 5 second, and then eventually you can work up to 10 seconds. If you get up to 15 seconds, you will breathe once a minute, which is kind of what I'm hoping to achieve on my end. But by increasing your CO2 tolerance in the comfort of your home when you don't have to wear a mask, it'll make wearing the mask much easier. So, as I was saying before, even after doing that one cycle of box breathing, I found that my talking is a lot more free. So that's how powerful it is right there. But that all being said, try to talk less, try to breathe through your nose, essentially shut your mouth and use your nose. And when you have some time at home, which nobody ever has time, but make some time, try some box breathing, or you can Google how to increase your CO2 tolerance. I'm going to put a link to a blog post on our website in the in the description in the video, and in that blog post, I'll have some links to some of the CO2 tolerance training resources that I use. That all being said, be safe, wear your mask. If you do feel this urge to tear your mask off because you don't like something on your face or you feel that you can't get enough air, try to find a nice open space where there's nobody around so that you can safely take your mask off and get a couple of nice breaths of fresh air. Sometimes that's all you need to reset. So try not to panic and be kind with yourself and be kind to those around you, and shut your mouth and breathe through your nose. All right, folks. Have a great day, and hopefully we'll see you at the clinic pretty soon.